Which one y'all like? Y'all like that one or this one?
That one.
Okay. Good afternoon, everybody. We on Blue Table Talk tonight. I'm your host, Deborah Jones, and thank you for joining us tonight. We have a great subject, one that I am very dear to tonight, and that is talking with the Beaumont Health Department with our director, Kenneth Coleman. But before we do that, we always do a clean up and housekeeping. But I don't even need to do housekeeping because the only thing I do about housekeeping, I talk about COVID. So why should I talk about COVID tonight when I have the expert to help us with this tonight? Good afternoon, Kenneth. How are you tonight?
I'm well. I'm well, Miss Jones. Thank you for having me on. It's great to be with you again.
Oh, thank you for accepting the invitation. And also my co-host, we have Toya. Toya, how you doing tonight? Ozan, you muted.
I said I'm fine. How are you guys?
Great, great, great. So we got Toria and we have Kenneth. So we have a lot of questions. I know people are coming on tonight with a lot of questions to ask you, Mr. Coleman, because it is so rare, not rare, but it's so spreading right now, and that's COVID. COVID is spreading a lot, and the reason why it's spreading because now I have it. And I'm like, nothing touches Deborah Jones. But then it hit my door. It hit my address. Good afternoon, Maxine Black. Thank you for watching us. And so, Mr. Coleman, I know everybody know you, but do you want to give a slight introduction tonight?
Well, my name is Kenneth Coleman. I'm the director of the Beaumont Health Department. I actually been in public health for 31 years. Became the health director in 21 when Miss Sherry Omer retired. So I'm from Beaumont. Family's from Beaumont. Uh, a proud graduate of Beaumont Charlton Pollard High School.
Yeah. I'm not Beaumont Charlton, but I am Charlton.
By way of Charlton Pollard. So
Right.
again, it's good to be with you. Again, I appreciate the invite because we like taking opportunities to share with our community what's going on. And so I really appreciate you inviting me to come on once again.
Well, I know that I was at your church one Sunday and that you were giving some insight on the viruses that was spreading around in Beaumont and just in Beaumont. And so as I sat down, I was listening to some of them because I didn't hear you when you began. But then I actually immediately would you come back to talk to the viewers about what you just spoke on. So how many viruses are out there just in our triplex? I know it's around the world, but I'm talking about in the triplex itself.
Well, what's happening now? There's so many different viruses, but what's impacting the healthcare system now is we're still dealing with COVID. Of course, we're dealing with flu, but flu is on a decline. But RSV is still pretty high, and now we're starting to see strep. So we're starting to see strep in our hospital amongst our babies. So that's what we're dealing with now.
So you speak of strep throat, right?
Yes, ma'am.
Okay, yeah, I realize that as well. I don't know of anyone who has RSV because tell me a little bit about that. I know that's the upper respiratory.
Yeah, RSV is typically happens in young kids, daycare age children. It's a respiratory infection, but typically it doesn't happen in adults, and so it typically happens in young kids. And it's the running nose, the coughing. So you're dealing with kids of daycare age and young kids in school. They share everything and they put everything in their mouth, and so that's why it's prevalent in that age group.
Right, right. So, like you said, the adults don't have to worry about that, right?
Not that they don't have to worry about it. Typically, it doesn't affect adults.
Okay.
Now, adults can get it, and if they do get it, typically it's from a parent that's caring for a sick child.
Right, right. Now, there's COVID that has been around. Look like it's gonna be around a long time. So, do we have to get vaccines every year for COVID or what?
Right now, they're not saying that, but even right now, we have the latest vaccine is called a bivalent, and it's called a bivalent because it's a combination of the medication to deal with the original COVID virus as well as the Omicron. And so right now, all the subvariants that we have is come from the original Omicron. So we're dealing with a new subvariant now called XBB.1.5. And early data shows with this particular variant that it's more evasive than the previous variants and subvariants, meaning that it has the ability to evade the vaccine. But again, it's early in this subvariant that is not enough data to determine whether or not this subvariant cause more severe illness or not. We don't have enough data yet to determine whether or not it caused more severe illness. But what we're seeing locally, and this is since November the 25th through January the 4th, we've seen a 400% increase in the number of positive cases. And this is in Beaumont. And in that same time frame, we've seen an increase of 500% in the number of hospitalizations. And so we're seeing a spike in positive cases as well as hospitalizations. Because now, and for all your viewers, we would ask that you like us on Facebook. The health department has a Facebook page where we release our COVID report daily. So if you were to go back to the month of October, I mean, we were reporting, 1 case, 2 cases, maybe 1 person in the hospital, right? But now we're kind of consistent with averaging anywhere between 18 to 25 cases a day. And now we're seeing today we had 34 that was in the hospital. But when I say reported, now this is only people who went to a healthcare provider and got tested. This is not people who used the home test. Those particular results aren't reported to public health.
Right.
So when you see the numbers that's being reported, that's people who actually went to a healthcare provider to be tested. So we're seeing a huge increase in the number of COVID cases, and that's across the state as well as across the nation. You're seeing a spike in cases because you have some states is really considering putting in mask mandates again, but we know that's not going to happen in Texas. So we're just asking people to be vigilant. Wear your mask, especially when you're around a crowd of people that you're not familiar with. Continue to sanitize surfaces, as well as, but the most important thing is we want everybody to be vaccinated.
Right. So what vaccine is out right now?
We still have the Moderna and the Pfizer. They're still available. Here at the health department, we're still offering a vaccine Monday through Friday between the hours of 8 and 4:30. You can schedule your appointment. The phone number is 409-654-3647. And that's Monday through Friday. You can schedule the vaccine. And on the vaccine, it's going to happen real soon where the vaccine is not going to be free anymore. The government is finna get out of the business of providing the vaccine free to communities. The vaccine will still be available, but it won't be free. And so while it's still free, we're still encouraging everyone to get vaccinated.
Okay, so since I've experienced the COVID issue, could I get vaccine now, or do I have to wait a while?
You would have to wait at least 90 days because
90 days after the negative form, or what?
From the time you contracted COVID.
Oh, okay.
90 days. And the reason for that is once you contact COVID, now you have the antibodies from the virus itself. And that's what the vaccine does. It gives you antibodies to the virus.
Okay.
And so you have protection. It's just that they ask you to wait 90 days because they really don't know how long natural immunity lasts. They thinking it's anywhere from 3 to 4 months. And so over time, your protection wanes. You lose some of that protection over time. So after your 90 days, then you can get the most updated vaccine, which will boost. The term, the booster it boosts your immune system back up
Mm-hmm.
to help you fight off the virus.
Let me talk to my the viewers right now. Good afternoon, viewers. How are you tonight? Thank you for joining Blue Table Talk. Go ahead and hit your share button. You know that sharing is caring. So then let them know that Kenneth Coleman is on with the Walmart Health Department, and we're, COVID is prevalent right now. So let's get everybody on here so they can ask questions to Kenneth Coleman, because you want to ask these questions about this variant that's around and why COVID is so prevalent in our city. Okay, so thank you. Go ahead and hit the share button. Okay, Mr. Coleman, wait. I have a question. There's someone want to ask you questions. They said, Maxine, hey, Maxine, how are you tonight? Thank you for joining us. Maxine says, so is there another vaccine for all the variant?
No, the latest vaccine, which they call the updated vaccine, is called the bivalent. And that's it's a combination of medication to protect you from the original COVID variant as well as the Omicron. Right. So that's why they call it the bivalent. So it's a mixture of two medications. So that's the most updated right now. And so that's the one now that's out there. And that's the latest one thus far. So if we can remember when COVID first started and when the vaccine first became available, everybody had to get their primary doses, which was 2. You had to get 2 doses, which was your primary series. Then they came out with that first booster, which would have been your 3rd shot. Then they came out with the second booster, which had been your 4th shot. Now you have the bivalent.
Right.
So if everyone would have taken the first 4 shots, now you would get 5 shots if you would take the updated booster. But if you only have taken your first 2 doses, your primary series, then all you need now is the bivalent. You don't need the 3rd or the 4th booster, because the bivalent booster takes the place of that 3rd and that 4th shot. But you have to have had the first 2 vaccines in order to be eligible for the bivalent booster. I hope that was clear. I hope that everybody understood what was just said.
Right. Kathy Wingate says, do you think things will get as bad here in the States as it is in China?
It's kind of hard to say. I would say no. And the reason I would say no is because the vaccine that we're using here, they're not using that same vaccine in China. They're using their version. So that's why it's, and of course, China, they're more congested than what we are in terms of just people. So I don't think it would get as bad over here as it is over there.
So when it first started with COVID, people were like dying and getting real sick, hospitalized, whatever. Do you see that going on now as well?
Hospitalization is increasing. For a long time, we didn't see any death. So, but now we're seeing, 1 death here, 1 death there. But it's in the elderly, right? And that's the age group, that 65 plus age group has the highest vaccination rate, right? But because we keep getting these different subvariants, and every subvariant that comes on the scene has the ability to evade the virus even more, or the vaccine even more. And I think what's happening with that age group, because they already have underlying health conditions.
Right.
And so once they get COVID, then that just kind of accelerates the other healthcare concerns that they already have. And I think that's what's going on with that particular age group. But we're starting to see death again, which is very, very unfortunate. And what we're seeing again, when you look at nursing homes and assisted living homes, is that the residents don't leave, right? It's the workers. And now that everything is open in Texas, now they allow visitors to go visit their loved ones in nursing homes. So the virus is being brought in to those facilities. which is very, very unfortunate for the residents of the facilities.
Tori, did you need to ask something? Tori.
Okay, I'm sorry. Mr. Kendall was talking about the nursing homes. Like I had an uncle who passed away because he was in a nursing home and he had COVID. And that goes back to workers bringing it in. And like I have people that work at the prison, the inmates are catching COVID because the COs are bringing it in. So is there a way, like, could they be fined because they're telling the correction officers, oh, come in because we're shorthanded?
Yeah, they can't be fined, and the reason for that is through our governor. He put out executive orders, and any governmental agency, regardless of what government agency it is, you can't put in a mask mandate, and you can't put in a vaccine mandate, and you don't have the right to ask someone to prove whether or not they've been vaccinated.
No, but if they have COVID, they're still telling the employees to come in.
Well, because the guideline states right now with CDC, which I totally disagree with the new guidance, is that you test positive, right? Then after 5 days, if you've been fever free for 24 hours without taking any medication and your symptoms have improved, then you can be released from quarantine. But you need to wear a mask for another 5 days.
Gotcha.
But in Texas, the fact there's no mask mandate, you can't make a person wear a mask.
Okay, I got you.
You follow what I'm saying? So
yes, sir.
That's always been tricky with the guidance because, down here in Southeast Texas, who doesn't deal with allergies? Who doesn't deal with sinuses, right? And so people, well, that's my allergies acting up. And they work for a government agency, then you don't have a right to ask that person to test.
Wow.
It's an honor system, right?
Yeah.
And so and then they came out with what they called critical infrastructure in terms of workers. And so what was happening before, everybody catching COVID, so you had police officers had to take off, you had firemen had to take off, and you had correction officers had to take off. But you still need to have a certain amount of correctional officers working in order to oversee the inmates. And so there was putting that pressure on those officers to come in. And that's very, very unfortunate, but that's just the reality.
There's no such thing as sinus infection anymore because I woke up one morning with my nasal was like doing the doggone thing, doing its own thing. And I'm like, oh my God, what's this? And then I went to the doctor and I told him about the same day I went to the doctor and I told him about it, that my nasal was just like doing his own doggone thing. And so he gave me a shot, for sinus infection. Because he know I have sinus problems. And so gave me a shot for sinus infection. And then a couple of days later, bam, I got COVID. So I'm like, what the heck? What the world?
I mean, you probably had COVID when you first went and saw your doctor.
Yeah.
He just didn't test you.
Just didn't test me.
He just didn't test you. And so, and then you deal with people who, where they work, when they don't work, they don't get paid.
Right.
And so you deal with that too. So people go to work sick. And then people send their kids to school sick because if my kids stay home from school, that means I have to stay home.
Right.
And they send their kids to school sick. So, and that's why you have this continual infection going on because, nobody wants to really follow the protocol that's necessary to prevent the spread. And so right now, with that being said, and that's why we still encouraging people to, one, get vaccinated.
Right.
And again, when you're outside of your normal circle, right? When you start finding yourself within a circle with people you normally don't hang with, then that might be a good time to put on a mask.
Yeah. Okay, let me go back to my audience. They were asking questions and I just looked over them. I know Maxine wants you to spell that vaccine you was talking about that
Bivalent
yeah, that one.
as Bivalent. I mean, it's still made by Moderna and Pfizer.
Mm-hmm.
It's just a combination of medication. It's two medications in one vaccine, and that's where you get the bi from. Means two.
Two.
Yeah.
Cheryl Chambers says, how long after having COVID can you get that new vaccine?
90 days.
90 days. Yeah. She just came on. Let's get her off. Kathy Wingate says, wait, hold on. She says, what does President Biden extend COVID emergency declaration means for us?
Well, when the federal government put in a declaration for any type of emergency, what that does for any local jurisdiction, that means you can request resources from the federal government. That's really what all of that means, is that you can request resources from the federal government. And him extending that declaration could mean that the government would still provide the vaccine. That's really what that means, that all states now have access to request resources from the federal government.
So could we still get those kits for to test ourselves?
The home test?
Mm-hmm.
Yes, and part of that declaration from the president is that with your insurance, you go to a local pharmacist with your insurance, then you're allowed to get 8 tests per the number of people that's on your insurance. So in other words, and that's 8 per month. So if you had 4 people on your insurance, then that's 32 tests you can get per month.
Okay.
Yeah.
And Mr. Kenneth, you had said something about the new variant. So say that you've already been vaccinated, you still can it's not going to affect the new one, correct? The vaccination.
Well, the vaccine, what the whole point of the vaccine is to reduce the severity of the virus if you was to catch it. The vaccine was never intended to prevent you from catching it.
Yes.
Right?
Yes.
It will prevent you from having to go to the hospital, which that's what you want, right?
Right.
Keep you off a ventilator.
Right.
So even like now, for a person who's been vaccinated, you take like Ms. Jones, and she shared it publicly that she caught COVID, but the fact that she's been vaccinated, that's why she didn't necessarily have a severe case, right? You might deal with stuffiness, you might deal with a cough, but most people who's been vaccinated, if they don't have any serious underlying health condition, pretty much get through it, as opposed to a person who's never been vaccinated. So you run the risk of COVID being extremely severe and harmful if you're not vaccinated, but it was never there to prevent you from catching COVID.
Yes, I get that part, but I don't know. I just thought you said that the new variant does not. It can override.
It can evade the vaccine.
Okay.
It can evade it. In each variant, we know we've had a lot of subvariants, right? And every time a subvariant comes on the scene, it's a little bit stronger than the next. And that's with any infection. You know, you have infections like now in Ohio, you have a measles outbreak, right? But there's a vaccine to prevent measles. Okay. So, but in this particular county in Ohio, I think the last number I saw was like 92 kids rather, that have measles. 90% of those kids are not even vaccinated. Right. And so anytime there's an infection that we eradicated, and when it comes back on the scene, it just comes a little bit stronger. Right.
Gotcha.
In a county in New York, they're dealing with a polio outbreak. And so now the conversation is whether or not people who have had the polio vaccine from a child
Mm-hmm.
You know, they're studying these cases in New York to determine whether or not we will all have to get a booster. Because anytime something resurfaces, it always comes back a little stronger.
Mm. And I myself, last year, I'm not vaccinated due to what my doctor said that it wouldn't be wise for me to get vaccinated. But I ended up catching it going to a wedding with, family.
Mhm.
And I went to the hospital, and it's like they treat you totally different when they know that you aren't vaccinated.
Unfortunately, because this is what I think. This is my
Mm-hmm.
theory. Is uh, because early on, when the hospital was inundated with a lot
Mm-hmm.
of patients with COVID, let me back up. We've had more people in this country to die from COVID since the vaccine was available than
Mm-hmm.
before the vaccine.
Mm-hmm.
And
Mm-hmm.
so people that worked in a hospital was being so frustrated because you refused to take something that could have prevented you from coming into the hospital,
Mm-hmm.
but because you would just refuse to take it, now you're putting our lives in danger.
Mm-hmm.
So now I got to care for you, which puts me in danger. Then I have to go home to my family.
Right.
So I think that what was going on with the medical community, because something was there is available to keep you out of the hospital.
And you wouldn't do it.
But because you just refused to take it.
Mm-hmm.
Not that you
Mm-hmm.
couldn't take it, you just refused to.
Mm-hmm.
Yeah, and I see that part. But when people who can't, like myself, who can't take
Right.
it, and then you do have people who aren't vaccinated, and they're just being reckless, and they're running around here without wearing the mask. So they're saying, "Oh, because you're not vaccinated," they point the finger at you. But for the people who aren't vaccinated, because they're rebelling and they're not wearing their mask, I
Now
just think that
I
that's
don't agree
unfortunate.
with people in the medical, because when you go into the medical field in the hospital, you've taken an oath, right?
Uh-huh.
And you shouldn't be judgmental about anybody.
Yeah.
So anybody that comes through your hospital, you're supposed to give them the best care that you can. I'm
Right.
not agreeing with that mindset. It's just
Yeah.
that that's the mindset that a lot of people in the medical community have expressed. I don't agree with it, but that's just what they've expressed.
Yeah. That's understandable to a point. Yeah.
Mm-hmm. How long does the vaccine last?
Well, what they're saying just from studies, they're saying anywhere it can be from 6 to 8 months.
Mm-hmm.
Then it start waning. I think they thought maybe by this time we'd be on the other side of COVID,
Mm-hmm.
because they thought majority of the people who are eligible, which is anyone from 6 months of age and older, is eligible to get the vaccine. But we still have very, very low vaccination rates, because even in Jefferson County, when you look at the ones who have received at least one dose, it's 58%.
Mm-hmm.
Only 58% of the people in Jefferson County received at least one dose. Fully vaccinated right now, they're still saying it's just 2 doses, and it's only 51%. So you look at Jefferson County, you have, give or take a few, roughly you have 250,000 people live in the county, and only half have taken at least one dose,
Mm-hmm.
or only half has been fully vaccinated. So that's 125,000 people that's not vaccinated,
Right.
right? And so viruses need hosts, whether it's a human host
Mm-hmm.
or an animal.
Mm-hmm.
And so you have 100. So if you were a virus, you have 125,000 people that's available to you. So thinking like a virus, hey man, I'm in heaven. I got 125,000 people,
I didn't touch. Yeah.
right? And every time the virus attacks each person, then what happens, it mutates,
Yeah.
Mm-hmm.
right? And then that's how you come up with these different variants and subvariants, because the virus is mutating.
It's mutating. Right. Can animals catch COVID as well?
Mm-hmm.
Well, I don't know if an animal can catch COVID. We don't have any documented cases that an animal has caught in COVID. But most of these viruses that we see, come from the virus itself. COVID is the name that was given to it, right? Because that's actually the infection. The virus itself is SARS-CoV-2. That's the actual virus that causes COVID,
Right.
right? And so that SARS-CoV-2 originated because what we're being told is that it originated in Wuhan, because in Wuhan, China, they eat every part of an animal, right?
Mhm.
And that particular virus originated in an animal that causes COVID in humans, if that makes sense,
Right.
Mm-hmm.
right? Most infections originate in animals, the virus itself, but not COVID. COVID is just the disease that SARS-CoV-2 causes, because really COVID falls under the family of coronaviruses,
Right.
where you have hundreds of different coronaviruses, right? Because if you look on back of a Lysol can, it tells you it killed coronaviruses, right?
Mm-hmm.
And Lysol has been around forever.
Forever.
COVID just started in 2019.
Yeah.
So it just falls a part of that family of coronaviruses. It's just one of many coronaviruses. Because if you can think back, when people, before COVID came along, we've heard of people go on cruises and then a lot of people get sick,
A lot of people-
right?
Mm-hmm.
That's a coronavirus. It just wasn't COVID.
Mm.
And they just named it COVID, right?
Well, this one is called COVID, right? Now,
Yeah.
how they come up with names, I can't answer that. But the virus itself is SARS-CoV-2.
Right.
That's the actual virus that causes COVID.
So COVID and Omicron, are they related? Are they?
Well, Omicron is just a variant of COVID,
Mm-hmm.
right? That's all it is. It's just another variant of the COVID-19 virus.
If I take the vaccine, COVID vaccine, it help me with the Omicron as well.
Yes.
Mm. Okay.
Mm.
Omicron, the different names is just variants or subvariants
Mm-hmm.
of the original COVID.
Rosa Hubbard said, and we already answered this one, is the vaccine still free? Now it is,
Yes.
until the government does what?
Until the government decides to get out the business of providing the free vaccine. And the reason for that is that when President Biden became president, he purchased enough vaccine for every eligible American to get the first 2 doses. Right? And you're talking about even nationwide, you still only have roughly about 50, no more than 55% of those eligible people have taken the vaccine. So there's a lot of waste. Because again, when you puncture that vial of Pfizer, when you stick that needle in that vial, then all that vaccine has to be used in 8 hours.
Mm.
Okay.
Follow what I'm saying? So if one person only come in that day,
Yeah.
but you've taken vaccine out, so now you're wasting
Yeah.
enough vaccine for 6 other people because it has to be discarded.
Right.
Oh, I didn't know that.
Moderna is 12 hours. And so that's why here at the health department, we still operate by appointments. And the whole idea about operating by appointments, even though a lot of people not coming in for the vaccine, is that we're trying to control waste.
Okay.
Right? So when you just have people just coming up, right, then you don't know how many people coming, you don't know who's coming. And so now you've taken this vaccine out of the required temperature setting,
Mm-hmm.
Mm-hmm.
Yeah.
then you got to discard it.
Just got. Mm-hmm.
Hmm.
And so that's why we still operate off appointments. It's really to control waste. We've always operated off appointments, even when there was a lot of people coming in,
Mm-hmm.
because we did it that way. Also, for your experience, we wanted you to have the best experience you can have when you're talking about coming to get a vaccine, right? Because I don't think it was a good experience when you had walk-up clinics, but you were in line for 3 hours.
Mm-hmm.
But you call us and your appointment's at 10, right?
Mm-hmm.
Then the latest you would get your vaccine would be 10, 15, 10, 20. I think that's just a better experience that you have an appointed time to come get your vaccine. So we tried to make your experience the best we could. And that's why we operated off appointments.
So can anybody go to the health department?
Yes.
You don't have to have insurance or anything like that?
No, it's free. We don't ask for insurance cards. We don't ask for ID. You have to sign the consent form, of course, understanding what you're taking, because we give you that, what is called a vaccine information form. And so that gives you the information about the vaccine. So to help you make a decision whether or not you want to take the vaccine. And so once you sign that, you sign the consent form, then we administer the vaccine to you.
Okay, I didn't know that. Okay, so we talked about COVID, but also last time we spoke, we was talking about monkeypox and we was talking about Delta as well. Seems like they are resolved. No one's even talking about that anymore.
Well, monkeypox is still around. There's not as many cases anymore that's being reported. But again, monkeypox is still around, and monkeypox is a particular group of people in America that was getting monkeypox, right? It was men who was having sex with men. And that's what was so concerning, because typically monkeypox is endemic to third world countries. Actually come from a primate, right? But monkeypox is really a deadly disease because there's not a cure for it, right? And so the fact that we were seeing it in gay men was truly concerning, because we've never seen it before, right? We've had monkeypox in America, but it was in primates, prairie dogs, right? It was never in humans. And so now you're getting this influx of monkeypox in humans, and then in that particular group. And what I try to make clear is monkeypox is not considered your common STI, sexually transmitted infection, right? They were getting it because they were skin-to-skin contact. And I tried to give examples. If I had monkeypox and had the blisters on my arm, right? And those blisters begin to leak, and then you come in contact with some of that fluid, well, there's a great chance that you would test positive for monkeypox. And so even though it was only talked about in that particular group, we had cases where a mother had it, and because she was caring for a small child, the child got it. Right? And we had women getting it from being intimate with a man because the man had it. So it wasn't just necessarily because a lot of people was thinking, well, long as you're not gay, then you don't have anything to worry about. But that was really misinformation.
Yeah.
It was skin-to-skin contact.
Skin-to-skin. Wow.
Yeah.
So anybody could have gotten it.
Anybody could have gotten it. Yeah.
Yeah, I get it as well. So it's still out there.
It's still out there. It's not as many cases anymore. But it's still out there.
What about Delta?
Delta?
You
got me on Delta. Now, Delta was a variant of the COVID virus. If that's what you're talking about.
Yeah.
It's just another variant. It's just like Omicron.
Yeah.
Yeah. Now we've been dealing with in Texas, no confirmed cases in Beaumont, but in Texas, we was dealing with Ebola.
Yeah, Ebola.
We're dealing with Ebola, and so it originated in Uganda where they had the outbreak, but they've gotten that outbreak under control in Uganda, and so of the cases that we were having in Texas, they were just being monitored because they traveled from an area endemic with Ebola, but none of them ever developed the disease itself. So we actually didn't have any confirmed cases. We just had several people that was being monitored because they traveled from an area that was endemic with Ebola.
Mm. Now, is it true that the COVID is that a man-made disease, a man-made virus?
I don't believe so, but
Okay.
that's some theories that it was man-made.
They say like a man in Wuhan ate a bat or something like that.
Well, that
I
doesn't
heard
make it
that.
man-made, right? Is the
Mhm.
fact that he ate an animal that was infected
Right.
with
Mm.
a virus. And typically that's how viruses spread.
Mm-hmm.
That's how they go from animals to humans. Because when you talk about third world countries and you talk about places like Wuhan, China, right? You talk about a lot of people and not a lot of resources. So they really don't throw away anything.
Mm-hmm.
And when you look at these other third world countries, it's really the rituals that they have that they've been doing for centuries. You know, when in some of these third world countries, when you talk about they eat monkeys, they drink the blood of the monkeys, they eat the brains of the monkeys, right?
Mm-hmm.
And so when you talk about these animals infected with all these different viruses, then that's how it goes from animals to humans.
Wow.
So, do you think it'll put a stop to it? Because I heard on the news, when you're coming in from China, you have to take a COVID test in order to enter the United States, which I think is a good idea. So, do you think that would help lower the risk,
Well, it'll stop the spread
the
because
spread?
you're coming from an area that has
Yeah.
high positivity rates, very, very high. And so in order to stop the spread, I mean, you have to do what you have to do as a country because with Ebola back in when we had the actual case in the Dallas-Fort Worth area a few years ago, and what they were doing, they were screening people that was coming from those countries. They were screening them at that airport in that country. And if they
Mhm.
were showing signs of or symptoms of having Ebola, they will quarantine them over there. And
Mm.
so that's really the best way to stop it from entering into your country is that you really need to go to that country.
Yeah.
And that's where you stop it because it's kind of late once you let them get in the airport, right?
Yeah, it's true. Yeah.
Yeah.
And so, and again, testing people coming from China, I mean, you can test today and it come out negative.
That's true. Yeah.
And then 2 days later,
They have it.
because the home test, it has if you're positive and the test come out positive, if it's 100% accurate, right? Now, but if you having symptoms of COVID and you use that home test and it come out negative, it has anywhere from, depending on what brand of the test you use, it has anywhere from 50 to 80% error. So if you're having symptoms of COVID, runny nose, sore throat, cough, and you use a home test and it comes out negative, the recommendation is that you go to a healthcare provider and have a PCR done.
Yeah.
But most
Okay.
people's not going to do it, right? And when you're
Mhm.
talking about a home test, you got to consider everything, right? It could be error on the tester, right?
Yeah.
Because are you really going to stick that swab up as high in your nose as you should,
Right.
Mhm.
right? And you're only supposed to use the home test if you're having symptoms. You're not supposed to use it if you're not having symptoms.
Exactly.
So it's a lot of error on the user when it comes to the home test. And that's why no health department, no healthcare provider recognize or accept a home test because there's a lot of room for error.
Hmm.
Well, I wasn't sick. I didn't feel, at least I didn't feel sick. I guess I did have the runny nose and coughing. I know because I'm still coughing. That's gonna last for me a minute. But I used the home test, and then when I got up and to see what it was, and they said, and it had those two lines. Like I said, I was like, what the hell?
And see, in your positive test on the home test, think about it, wasn't reported to me. So
Right.
the numbers I release daily, you're not included in that number. So just think about just think about the however many other people that use a home test.
Right.
Those numbers aren't reported. So when you look at reported numbers, to have an idea what could be within your community, right? You can take that number that's reported and you can multiply that number by 8, by 10, and you may come close to what actually is going on within your community, right? And then you got to think about the people who don't test.
Right.
I'm not going to test because I'm just going to tell everybody it's my sinuses.
Right.
Because I still feel okay. I still can go to work. It doesn't have me down. So I'm going to tell people it's my sinuses. Because if I tell people I've taken a test, right, they might start thinking that that person has COVID.
Now, I'm glad you brought that up because you are so right. A lot of people talk about it was their sinus and they don't test.
They don't test.
They're spreading that. They're spreading it.
Yes, they are.
And so, what do we do in those instances? It's nothing we can do about it, right?
It's nothing you can do about it. It's nothing we can do about it, even as a health department. It's because of the executive order from the governor, right? And that just took the teeth out of everything we could have done, or at least try to do anyway. And if you can remember early on, we did what we call contact tracing. So when we get a report in, for example, we'd have gotten your report in, right? The health department would have called Deborah Jones, right? And we would ask, okay, how you feeling? Then we'd ask you, okay, who are your household contacts, right? Then we'd ask you, well, where have you been? Have you been to church? Where have you been working, right? But we have lawmakers in Texas that said that was too intrusive.
Right.
And so we had to stop contact tracing.
That's crazy.
Yeah.
It is.
And you said something about the sinuses. Like one of my daughters, she suffered with really bad allergies. And so it's like she knew the difference. She said, Mom, I think I have COVID. Because it's a huge difference.
It is.
And she keep her mask on, but they had a pep rally. And she was enclosed and she has underlying conditions. But she knew when she had COVID, she knew it wasn't her allergies.
If you suffer with allergies or you suffer with sinuses, right? Or if it's something you typically deal with, right? And if you catch COVID, typically sinuses, allergies, or whatever the case may be, we all have our medication that works for that.
Yeah.
And when you take that medication and it's not working, that's a sign right there that you're not dealing with your normal, typical allergies or sinuses.
Yeah.
It's something else that's triggering it, right?
Right.
And when we talk about the mask, and one thing we have to understand about the mask is me wearing the mask and you guys not wearing the mask, right? My mask protects you from me.
Yeah.
Right.
But my mask is not foolproof as protecting me from you.
And that's crazy.
And that's why it was incumbent upon everybody to wear the mask. And that's how you stop the spray.
Right.
Now, wearing a mask is better than not wearing a mask. It gives you some protection. But it would take everybody to wear the mask to really stop the spread. Because now, if everybody was to wear a mask, right, now the virus has no human host anymore. And so that's why the whole idea with the mask and the 6 feet, it wasn't either or, it was both.
Right.
Right? And but you have so many people who didn't adhere to the guidance, right? Just refuse to wear a mask because you can't make me wear a mask. I don't have to wear a mask, right? And they were going everywhere. And so that's why we're where we are because of that. Yeah.
And is it true that this is a trial run with the COVID vaccines?
What do you mean?
Like they say, okay, just for instance, I went and had the shot and something happened to me. it's nothing you can legally do because it's only a trial. After 5 years, then it becomes like, like the flu shot. Is that true?
Well, at first when the vaccine came out, it was under EUA, Emergency
Okay.
Use Authorization.
Hmm.
But now both the Pfizer and the Moderna vaccines have license.
Okay.
They're no longer under trial, so to speak. They both have a
Okay.
license now. I mean,
Okay.
because they have enough people who have gotten the vaccine where they have a
Mhm.
large study now,
Mhm.
right? And so they can study, and that's why when you take the vaccine, they ask you to register with VSafe. And so when you would put your number in, your cell number with VSafe, and that's from
Mhm.
CDC, they would send you a text message. How you feeling? You have to just fill out this little thing on your phone. How's your pain? How you feeling today? And they would constantly send you out these messages, checking on you to see how you feel. And that's how they were able to gather information about everybody that's taking the vaccine.
And you know what's crazy out here, Mr. Kenneth? Like when you go to the school, and like for instance, I told you about my daughter.
Mhm.
I called to inform them that she caught COVID. We knew where it came from. It was at school, and we wanted to let them know. And they said, "Oh well, it's just send her back home. They're not keeping tally. They're not calling it in anymore." And I think that's crazy.
Yeah, but from COVID, I found out that governors of every state has a lot of power.
Oh yeah.
Have a lot of power, and no one can override what a governor says for his or
Right.
her state.
Right.
Federal
Mm.
government can't override it. And so what you was having a lot of the southern states
Mhm.
that was wide open,
Mm.
right? Because of the governors put in those orders that for governmental agencies, you can't mandate anything. Because even here locally, you started off where every kid was virtual,
Yeah.
right?
Mm.
Then they put in, as a parent, you had an option. You can go virtual or you can go on campus. Then they took out the virtual option.
Mhm.
Every kid had to go to school on campus. Then for the parents who still refuse to send their kids to school, then they put in if your kid missed X amount of days, then your kid get retained,
Yeah.
right? So they was putting in all those steps where it was forcing parents to send their kids to school.
Yeah.
Hmm. It's
It's
something.
sad. Yeah,
Yes.
it really is.
What makes one virus more contagious than the other?
It just depends on the virus. It just depends on the virus. All viruses are contagious,
Right.
right? All viruses are contagious. It's just that some are just a little bit more contagious than other, but most viruses, you contract them the same way.
Mm.
Respiratory droplets,
Right.
right? Touching surfaces,
Right.
right? That's how you get most viruses, right? And so if you can think back, that's why, as I say, is a method to the madness when your parents told you to wash your hands,
Mm-hmm.
right? So the whole idea behind washing hands is so that you don't put your dirty hands in your face,
Mm-hmm.
right? You touch a surface, you don't wash your hands, you wipe your face, you wipe your eyes. There it is,
Right.
right? And so that's why we need to always be sure we're washing our hands and we cleaning surfaces.
Mr. Kenneth, I have a question. When you go to the store and you see people, whether they ringing you out, say you go somewhere and they're ringing you out, and they have these dirty gloves on, do you say something? Because I know I do, but do you say something to these people?
I have. I
Okay.
have, and we talked about that last time with the
Yeah.
glove. Um, People think because I have gloves on, they thinking my hands aren't dirty.
Right.
Mm-hmm.
But they don't realize the gloves are,
Mm-hmm.
right? And so sometimes it's better for a person not to have on gloves
How is a nice, because your delivery is different than mine. So what is a nice way to tell them that they're nasty and they shouldn't do that?
Well, you can ask them just, ma'am, sir, you need to change your gloves.
Okay.
You need to change your gloves. I mean, because you see it, you'll see people that work at, on the break, working at a fast food restaurant. You'll see them outside with the gloves on.
With the gloves on.
Right?
Or pumping their gas and getting in the car, touching it.
Yeah. Because again, in their mind, my hands aren't dirty.
Right.
But they're not, they don't realize, and a lot of time it comes from being educated, right?
Yeah.
And so it's very, very important for managers. That's why, at least in Texas, every restaurant has to have a certified food manager on site as long as the business is open. Right. Okay. And so typically it's the manager that comes or goes through the certified food managers course. Okay. But it's incumbent upon that person to go back and train and educate the lower staff. Gotcha. And a lot of times that doesn't happen in a lot of these restaurants. That doesn't happen. And when you think about restaurants, especially fast food, the turnover is so high.
Yeah.
And so it's all about getting a product out. It's all about getting a product out. And until a lot of the workers' defense, they're not being trained on food safety.
Yeah, that's true.
Right? And so what the state of Texas done now is required that everybody that works in a food establishment, regardless of what you do, you have to have a food handler certificate. Right. So we're required now for people who get a temporary permit, like if you want to sell something for an organization, somebody at the site have to have had that food handler class, because the food handler class is all about food safety. It's all about food safety.
Okay.
Homeware, guys, the clock on the wall says it's almost time for us to get on out of here. So I appreciate you, Mr. Kenneth Coleman from the Beaumont Health Department, Director of the Beaumont Health Department, for coming on tonight. It was so much great information and very informative. And I hope that you can come back again. I know that there are more viruses that probably be coming in every day, and we just don't know about it. But just keep us informed on what's going on, because we do need to know what's happening. Because I mean, like I told you, I was shocked when I got it.
Me too.
I'm like, and I always try to be cautious of things, but.
Yeah, some people have it and don't even realize they have it. So they're not intentionally trying to spread it. But again, thank you. I enjoy coming on. I enjoy sharing because my goal here at the health department is I really want the health department in the city of Beaumont to be that trusted source. I want people to call us when they have questions, right? And again, I would ask your audience to like us on Facebook, Beaumont Public Health, because we release information and updates all the time. So like when we get information about when they had the norovirus and the oysters coming out of Galveston Bay, we release that on our Facebook page. That's how we inform our citizens. So I'm asking your audience to like us on Facebook. We're doing different things here. Real soon, you would be able to go online to view restaurants' inspection reports, and so that's coming real soon. I'm anticipating by the end of this month that will be available to the community that you can.
Is it like I'm sorry to cut you off, but like what Bill Leger used to do?
Yeah, see, Bill Leger used to come through open records requests because it's all public information, and so he would request all the inspection reports for a period of time, and then he would do the Leger report card, right?
Yes,
right.
And so that got a lot of these businesses to do right. But now anybody can go to the website. And so when that becomes live, then we'll send that information out on our public health Facebook page to let the community know that that's available and where they can go to look at any restaurant in Beaumont.
Oh, that's good.
And get the last inspection report. So that will be available to the community. As well as now you can go online and request a birth certificate and or death certificate. And you do everything online, and then you pay online, you do everything, and then you have an option of checking to come pick it up in person or have it mailed to you. And so if you check to come pick it up in person, then what it does, it sends you an alert to the number that you put in to let you know your birth certificate is ready or your death certificate. So you don't have to come in, fill out no paperwork, and wait.
Yeah.
And so that's available now.
Oh, okay. That's a
So you go to the BeaumontTexas.gov, go to the departments and check health services for the department. And then there's that link.
Okay. There. Is that only in Texas?
Well, we have it in Beaumont. Now, you can get a birth certificate from any vital statistics office in Texas, regardless of where you were born in Texas.
Oh, okay, in Texas.
Yeah.
Okay.
It's only for Texas residents. Yeah. See, like you in Georgia, if you needed a birth certificate, you just go online, process everything online, and you click the button, mail it to me, and we'll put it in the mail.
Okay, no, I thought you can get it because my husband was born in Louisiana, and I
wanted. No, he have to go to Louisiana. He would have to go.
Okay, got you.
Yeah, it took me the longest to get my my birth certificate because we were born in DC.
Yeah,
and it took a long time to get that.
Yeah, you actually have to go back to the state.
Yeah,
in which you were born to retrieve the birth certificate.
Right, exactly. But you know, it's interesting. So I just like you said Beaumont Public Health Department. Is that what it is?
Yeah.
Like
Beaumont Public Health. Beaumont Public Health, that's our Facebook. Beaumont Public Health.
Beaumont Public Health. It says follow. Okay. Thank you for all the information. And I know the viewers are really excited about you know, what you just said about all the variants, and follow you on Facebook and everything. So y'all, tonight we talked to Kenneth Coleman, who is the director of the Beaumont Health Department, and he has some very informative ideas, but issues. Talk to us about everything that's going on in here in Beaumont, Texas. Like he said, like I told him earlier, he said I put it out there that I had COVID. Yes, I did. But let me ask you one more question. If I take it again and it says negative and I still feel sick, what happens from there?
Well, you're just having some of the effects of having COVID. And sometimes the cough could linger.
Oh, I know it will.
Yeah, it can linger. Yeah. So, if the test come out negative, you're negative. You're just having some of the side effects associated with COVID.
Because they did give me some Paxlovid.
Yeah, and that's to help with the symptoms.
That
it just that's the treatment that's available, and that's what's really recommended for people who catch COVID. When you start having those symptoms early, you get that treatment.
Yeah. I mean, I got it. I called in that same night, and to the doctor, and then they sent it to the pharmacy. And
it's in pill form now because we had a clinic in Beaumont one time, but it was through IV. That did with that thing. Yeah, it was by
an infusion thing.
An infusion. That's all it is. It's just in pill form now.
Okay.
It's in pill form. That's what they was doing at the infusion center. It was Paxlovid.
Right. So they don't have the infusion place anymore, right?
No, because when the numbers dropped, then they closed the infusion center.
Well, that's so.
Well, yeah.
I ain't gonna say.
But that Paxlovid, it's just in pill form now.
Okay.
Same medication.
Yeah. But they gave it when they gave it to them, the doses wise from the infusion. Did you have to keep going back and get it?
Nah.
Just at one time? Okay.
But it was being injected. It wasn't in pill form.
Okay, I
Yeah.
see. Cool. Thank you so much. Thank you so much.
Thank
Tori,
you.
Thank you.
Thank
I
you.
appreciate my
You're
co-host. She's
welcome.
always by my side. I love her to death.
Love you too.
And I appreciate you. So good. Thank you, audience, for joining us tonight. You guys are always great. Next week we'll have our guest for next week will be Nikki Perry, who's a TV host and a writer. So tune in and let's see what's going on with Nikki. And so from there, we want to say good night to you guys. Thank you for joining Blue Table Talk. God bless you. God keep you as my prayer. If I can help somebody, if I pass along this way, then I know that my living is not in vain. God bless you, God.
Talia, it was nice meeting you.
You too, Mr. Kenneth.
All right. Take care. Thanks
Bye.
again.
Okay.
All right,
Bye-bye.
Ken. Bye-bye.
Bye bye.